Hello, I'm Adarsh from Fever 104 FM. You're tuned into Bangalore Cafe on Fever. Today in the studio with me is Dr. Lokesh Veerappa, who's a senior consultant orthopedic surgeon and sports medicine specialist. Welcome to the show, doctor.
Hi there. Hi, Adarsh.
This campaign is called Surgeon on Air. It's brought to you by Sironix, that is an arthroscopy division of Healthium MedTech. Welcome to the show, doctor. Let's start with how you are doing today, because nobody ever asks the doctor this. Doctors always ask how you're doing, how you're feeling, but nobody asks the doctor that. So how are you doing today, doctor?
I'm good, Adarsh, and it's nice to be here. So being a sports medicine specialist, we are into taking patient care and doing surgeries and all, and of course this aspect of doing interviews with Adarsh here, it's nice. It's a good change for us.
It's a bit of a change, like a different day that you're having. Because
I know, yeah. So of course I love my job, but it's always nice to have different flares to life, isn't it?
True.
Yeah. So I think it's interesting. It's going to be interesting.
Do you listen to the radio, doctor?
Oh, I do. Okay. I do listen to Fever also quite a bit, and I like the song selections, of course, and all your RJs. Nice. It's a good channel. Yeah.
Thank you so much, doctor. So let's start with a brief introduction about how you got into this field. Was it a passion from before, or did it just happen coincidentally? Was there some influence that in your family or someone that you wanted to be like? How did you get into this field, especially into orthopedic medicine?
Okay, see, MBBS was more generic, like typical a Bangalore born, a middle class guy, he wants to aspirational, you get into medicine. So the MBBS was just that. But orthopedics was, of course, I was pretty attached to it even during my undergrad days and all. So then I got my orthopedic PG from PGH Chandigarh. So that's where I did it. And then shoulder and knee, especially sports medicine and all, was still in its infancy.
Correct.
When I trained, it was not much there, and arthroscopy, which is like a keyhole surgery and all, it was not much done in India about 20-25 years ago. There were some of them, but not really good. So that's when I went abroad and did some fellowships in shoulder and knee and sports medicine. And then I wanted to start that here, and it's been good, a good journey.
I'm happy that like whatever you dreamt in your childhood, like you could do all of those things because you always wanted to do medicine, like a typical Bangalore boy. You said another thing that boys want to do, or like people generally want to do in Bangalore, is engineering. I did that.
Okay.
But with zero interest. Okay. I was not into it at all. It was just like all my friends were doing it. I'm like, okay, medicine engineering medicine engineering madana. Finished it but didn't pursue that at all. But great, good to know your story, doctor.
Yeah, see, I always feel that getting into orthopedics is one of the best decisions I've done because it's pretty gratifying also. See, we fix a bone, or we see the x-ray, we know the result, and it's good, and it's I've always liked this, and it's much more interactive and taking care of the day-to-day stuff rather than more serious stuff like cardiac and neuro so it's not so heavy.
It's not so heavy, at least to your brain and heart. Like I'm sure emergency medicine and stuff like that must be like seriously.
It's good to have it for a few days, but I would as I told you,
you're happy.
Is good.
You're happy. Okay, doctor, usually what are the complaints that people come with? What are the common ones that people usually come to you with, like the first time when you see a patient?
Okay, so there are two categories of people. One is a person who is having an active lifestyle, kind of a sports person and all. And a second group of people which is common in Bangalore, like the typical, I would not say all of them because the software engineers are going to not like it, because but a lot of them, they have a sedentary lifestyle and they've been sitting in one place in wrong postures for long times, and so that's another category of patient. So we have an active patient pursuing active stuff like sports and all, and they get injured at that point of time, and they come to us with that injuries and ligament tears and shoulder dislocations, those kind of people. One group of people. The second group of people are like, of course, we cannot categorize both old people and the sedentary lifestyle people in the same, but it comes to the same because all those peoples of inactivity and couch potato kind of active stuff, all of them add up and they get into problems with stiff necks and frozen shoulders, those kind of stuff. So, and a lot of them, they come with neck pains and tennis elbow and those kind of stuff. So that is one category, and the active sports people is another category. So both of them present with pain is the main symptoms, of course, pain and stiffness. And usually that's how these two categories of patients are there. And of course then we ask them about how what is your day-to-day activity, what is your day-to-day lifestyle, and that's my baseline, because then we actually can assess what is their physical stamina or ability in terms of what is going wrong in their personal way of functioning, which caused the current problem, isn't it? So that's how we probe into this.
Okay.
And then
then you understand what might be causing that pain.
Yeah.
Which leads me to my next question actually. How do you understand? Of course, you told a little bit about like how you actually ask them questions, and then based on what they say, and then you get it deeper into it. How do you know what kind of pain it is, and how do you like diagnose other than like asking them? I'm sure there are like other procedures.
Yeah, so that's a good question, but it's understanding pain itself is very a wide thing. What happens is pain is basically it can be just a simple injury which is causing pain in the region, but wrong postures, people, for example, I'll tell you, people who sit in front of the systems for say about 6-8 hours, they slouch where you bring your shoulders together, and they crock their heads like that, and imagine they're sitting like that. That's how the Westerners describe the Indians driving a car, that.
Oh yeah,
like that, yeah, but that's them. Okay, so you sit like that for long hours, and of course you're going to be having shoulder issues and neck issues and all. So that is posture. That is one thing, of course. And on the other side, when injury patients, that is because of the wrong technique or the wrong method of doing stuff. So that also we ask. So all these things leads to specific types of pain, like a patient coming with you with a shoulder pain, and he is having it whenever he does a little more activity than usual. Then there will be something wrong with the bone structure, some muscle may be torn, those kind of stuff. Or a diabetic patient, coming with a stiff shoulder, he's not able to reach out to his pocket, he's not able to reach across, and those kind of things are frozen shoulder. So like that. So basically we ask questions to come to a diagnosis, and pain is the basic thing, and we also grade it, like mild, moderate, severe, and what causes pain, what are the activities that cause pain, and what brings it on, and how did it happen in the first place? Was there an injury? So we actually ask leading questions, and then we'll come to a conclusion that okay, this is what has happened with this person, and this is what we need to do. Yeah.
When someone says they have a pain, what does it usually signify? What is the underlying problem? What does pain signify?
Pain signifies that there is something not right with the person in his day-to-day functioning. So mild pains, they would not come to you.
Correct.
So they'll just rub in some balm and take a paracetamol.
Cold pack.
And that's what they would do. So if a person is coming to you and taking time out and taking an appointment and coming to you, that means the pain is significant. That's like, to begin with, that's what it is. So all pains, however they may grade it, is not insignificant. There may also be an apprehension associated with the pain, in the sense like they have seen something. See, we are all a product of what we see and what we notice, isn't it?
Correct.
So they must have seen something in the neighborhood or in their colleagues, and they are worried about it. So those kind of people also come. They don't have too much of pain, but they are worried that it may increase, it may aggravate. So we get those kind of people also. For them, we just have to assess and analyze, and we tell them that nothing to worry, you got to do these things, you'll be fine. So that is one category. And of course the injury patients, and there are a category of patients who ignore it for like nothing's going to happen, and they
I did that once. A lorry tire went over my foot. When I was in the signal. This was when I was in college. And I was like, yeah, it's fine. It was going running and everything. But after a month, it was still there. But it was not become more. So I was not like too worried because there was no swelling or stuff like that.
Yeah.
But it was still paining.
Yeah.
Then I finally went to the doctor. There was nothing. There was no fracture or anything. I think it's just the edge of the tire that went, and I was wearing a thick shoe.
Okay.
So it was not that heavy, but it was a truck. So, but then I ignored it for the longest time. Thankfully, nothing much had happened.
But you got closure on it, isn't it?
Yeah.
So it's always important to have closure.
Correct. Once the doctor tells, I'm like, okay.
Yeah.
If the doctor is telling, then maybe there is nothing. Until then, my mind was not at peace.
That's true. See, 50% of the times it may not be anything big and anything significant, and it's still you're having closure and you're at peace. You can have a peaceful sleep. But another 50% of the times it may be something significant, and you're ignoring it, and it may be something big, and you are actually ignored it to a point that it's come to a point of no return. You got to do bigger stuff.
Yeah, like
see, early on we can do simpler stuff, simple treatments
Rest
and those kind of things. And but you ignore it for a long time, then you got to do bigger stuff like do a replacement and stuff like that, isn't it?
Correct. So it's better to go at least for that mental satisfaction. Even
I
if
know
there's
you should visit the expert. That's the way.
Yeah.
Rather than googling, a lot of people do that.
True.
A lot of people say, "See, doctor, I have spondylitis." They come and say that. So I say, okay, let's start with what symptoms do you have?
What symptoms do you have? What do you think should be the treatment?
Yeah, yeah, I know.
Yeah.
So people do that. I know, but. Nowadays we're going to take it with a smile, because a lot of people do that.
It's there. We just have to live with this necessary evil.
Absolutely.
Okay. So, what are the risk factors that may lead to conditions like stiff joints, loose joints, diabetes, and like all of obesity and stuff like that? So,
of course, age is a bummer. So, of course, it's gonna creep in on you. But if you're active. Say after 30, 35, 40, if you have an active lifestyle, then it would actually not trouble you so much. So that's to begin with. Second thing is some of these things like diabetes, and obesity and a sedentary lifestyle, not exercising.
These are the problems.
These are the risk factors. And of course there are things like rheumatoid arthritis, those kind of arthritic stuff are also there, but generally speaking, so not so active lifestyle and excessive body weight and those kind, and diabetes and hypertension and those kind of stuff. Okay. They all add up and they cause trouble. Even hypertension causes trouble in your joints, is it? No. Okay. Hypertensions cause giddiness and they actually wooziness. Okay. The falls are we have seen patients who actually have falls because they not have a controlled hypertension and all right. Post falls coming up with injuries and all. Yeah. So basically sedentary lifestyle, obesity, probably hypertension and diabetes, these are the factors that cause these things, so you have to avoid as much as possible. Yes. Yeah. Okay. If we start, I already gave a live example as to how I did it. If we neglect the pain and if we learn to live with it, how will it impact us in the long run? Yeah. So as I told you, see, people do that and it is not a good thing to do because the earlier you treat it, it's going to be cleared and you're off it. For example, I'll give you an example. We had a case of shoulder dislocation guy. Okay. He actually had dislocated about 50 times, 50, and he dislocates and he relocates himself. He does a quirky movement. Oh, so that's possible, is it? Yeah, they do that. Some people do that. Oh yeah, like I've seen that in some TV movies. Loose jointed guys, no, they do that. They do like that. Yeah, and they so they ignored it, and there was a huge dent on the bone. So what would have gone away with a simple arthroscopy, like a keyhole surgery, which would have fixed it and we've been fine with it. We had to do a big open surgery, put in bone graft to fill up the huge dent and stuff like that. So we had to do a bigger procedure. So it's like that. Of course, we fixed it. So what would have gone off with a simpler thing, it goes in for bigger things. Like for example, people who have ligament injuries in the knees. So if they ignore it and they say nothing's going to happen, we're going to what's the big deal, and then after a few years, 7-8 years, they become arthritic. It wears and tears. Okay. And that point when it wears out, you cannot fix it. You cannot just fixing the ligament won't help because the knee is worn out. Then we have to do a replacement, something like that.
Okay.
So there are instances. If you ignore sports injuries and typical any injuries, we cannot always say sports injuries. Like there are a lot of housewives, who get tennis elbow by doing household chores excessively or things like that.
Yeah. This is like an occupational hazard is something what I've heard. I visited a doctor when I had some infection, and at that point of time, she told me a story about her mom, who was a gynecologist.
Okay.
And because of what gynecologists do, she had a arms, I think, this thing over years. Like she was 60 plus, maybe 30, 35 years of doing this occupation has also led to her arm being worn out or the elbow thing or something like that. She told me. I was like, even doctors go through these things because of these things. Another example is I had a rapper on my show last week.
Okay.
He had a paralyzed father.
Oh.
Okay. Because of an accident that his dad had.
Okay.
And this guy, 18, 19-year-old, but since the age of 12, he used to lift his father, take him to the bathroom, and so the shoulder was worn out over years.
Yeah, see?
I had asked him to come to the studio. He said, next week I won't be coming for the next 2 months from next week. I was like, why? What happened? He's like, I have a shoulder surgery. Then when he came in, I asked him what happened and he told me this. I was like, oh, so these day-to-day activities done over a long time might also cause it, is what you're saying.
Yeah, that's true. A lot of people, have a habitual way of clicking their shoulders, like breaking a knuckle kind of way.
It's, I can't even see it. It's very hard to even watch.
I know people do that. And so those things, of course, you're damaging the shoulder. And of course, it comes to a point then when you can't ignore and then you have to do surgeries. So, of course, see, whenever you have anything which is bothering you and which is beyond your purview of understanding, I think you should visit a specialist. That's the basic way.
Especially if you are doing something 50 times, relocating your shoulder back 50 times.
I know.
That's super shocking.
Yeah.
Okay. How can one, over time or with good practices, better the health of the joint so that it won't get injured in the first place?
See, the bones, joints and muscles are the structures, and the nerves are like these electrical signals which tell them what to do, isn't it? So, regarding joint health, the most important thing is mobility. Like, for example, this I always tell my patients, if you have a sedentary lifestyle, the lubrication that is supposed to maintain the joint, for example, the knee in a good shape, is not going to happen. So, and the cartilage or the inner coating will peel off like a piece of paint when you overload it. If you have lubricated it well, in the sense like if you're doing a physical activity daily on a regular basis, so your knee is in good shape, it's well oil lubricated, and the cartilage is pretty strong. So however much you load, it doesn't gonna go wrong, and nothing's gonna bad's gonna happen that way. So joint needs mobility. So that's very important. So all the joints for that matter, mobility is the key, because we are meant to be mobile. We are not meant to be sedentary, isn't it? So mobility, of course, you got to have proper, you don't sit in front of a YouTube and start doing stuff. Because initially, you should actually, I would say initially you should have a proper trainer to do it the right way. And maybe once you are a little trained, you can pick it up yourself after that. So mobility is the most important thing for the joints. The second thing is the bone. I was telling you, bone health is important. We have seen that people who are physically active in the first 30 years of their lives, they don't get osteoporosis. Osteoporosis is like where the bones become weak and porous, after about 50-60 years of age. People who have been active in the first 30 years of life, they don't get osteoporosis early. They are good, they have good bones even at 60, 65 now. So bone health is important. So you got to eat well and have your calcium, rich foods and stuff like that. The third thing is the muscle. Muscle is supposed to be kept flexible. Muscle injures, only when it is tight or when it is weak. So if it is not weak, not tight, flexible and decently strong enough, it won't get injured. So everything boils down to one thing, that is mobility. You are mobile, you are physically active, automatically you are in good shape and things go properly. You don't...
So keep it flexible and keep it mobile.
Yes.
Is Dr. Lokesh Veerappa's mantra if you want to take care of your joint health. A lot of people have shoulder related pains and injuries in their shoulder that they wouldn't have noticed, or they would have just let it go thinking it's a very small thing. But how does that affect day-to-day activity, and when do you think that they should absolutely see the doctor?
Yeah, you're absolutely right, Adarsh. There are so many scenarios wherein, people have trouble with simple stuff, As I told you, taking a wallet out of your pocket, reaching across to your other shoulder, reaching something from a higher shelf, you're having trouble. You do a little bit of more activities in the shoulder, you start paining. Like a person is going to the gym and he lifts a little more weights, he's starting hurting in the shoulder. Like even a housewife, the household chores she's doing at the end of the day, the shoulder started hurting more. So these are scenarios wherein you should go and meet a doctor. Otherwise, there are chances that things can get worsened. There is a condition called impingement wherein the bones keeps biting into the muscle, and if you ignore it, it can tear. And if the muscle tears, it's a bigger thing. You need a surgery. But before that, if you go to a doctor, there are chances that he would do some physiotherapy, maybe give an injection to the shoulder and cure you. So we should not ignore these small day-to-day problems or difficulties you face in the shoulder. You should actually, of course, reach out to the doctor, and that will be able to help them solve that and get on with their lives in a regular way.
A lot of us do recreational weekend sports activities. I play badminton and football once in a while. So weekends are the time when, especially in cities, like weekdays it gets really hard because you have a whole day's work. Does that affect joint health as well? Or is it good to do that? Or do you need to be careful?
Okay, so let us take it this way. See, this is what's going to stay. See, we are in a city and we have a busy lifestyle. I would not actually say anything against it, because physical activity is important. If of course a daily bits of physical activity is good enough for the body, it is better than only a weekend activity. But of course a good weekend burst of energy wherein you replenish your body, those things are good. I would encourage that, but don't go overboard. You are not compensating for the week's stuff.
Yeah, that doesn't
You
work
are having
like
a good time, you should be like that. There are people who do that.
Yeah.
I did not do my 10,000 steps in the last 4 days.
So I'm going to do 30,000.
I'm going to, that is crazy, isn't it?
Yeah.
So we should not do that. So weekend, it's good to refresh yourself for the next week and feel good about and enjoy whatever sports you are doing, whatever activities you are doing. You're not on a target, like you got to do 30. Those kind of stuff is not right. So weekend physical activity is good because it's also good for socializing.
Correct.
And you get to be physically active and you are actually regaining that energy.
And mental health also, right?
I know, absolutely. Yeah.
Is there a cure to conditions around joints and muscles? Does it heal naturally? What are the treatment options if we come with an injury? What are some of the treatment options that you suggest when there is a joint related issue or a bone related issue?
So usually I would say, I think this most of the people should know is, it's called the RICE therapy, rest, ice application, compression, elevation. Whenever there's any injury of any part, like a shoulder or a knee or an ankle, so that's what you got to do. You got to rest the part, apply some ice. You can put in a crepe bandage or something and keep it elevated so that the swelling for some time, that would take care of the initial part. And for example, so many of the injuries, for example, are minor injuries that would go away with simple treatment like these. But beyond that, you will realize yourself that it is not, so it's not as simple as that. The swelling is too much, the pain is too much. Then of course you should visit a doctor. And there are lot of conservative methods of treatment wherein we can actually take care of these things by doing some physical therapy, exercises, or those kind of stuff. But of course there are injuries which needs surgical intervention, like I told you about the shoulder dislocations or people having frozen shoulders for years together.
Knee replacement for arthritis.
I know. So knee replacement is for arthritis. We do that also. But the thing is, before the knee replacement, there are a lot of subtle things, like you're going weak on the knees, in the sense like you have a knee dislocating often when you're walking, those kind of stuff. That means you have a ligament injury and that needs to be fixed. So those kind of surgical options are there. So there are ways of, all injuries does not end up with a replacement. There are injuries which wherein you fix it and they get back to their 100% level of activity. Like there are so many of them who are like badminton players who had repeated shoulder dislocations. And usually dislocation happens when they do overhead activities. And we fix them, and they have got back to 100% level of physical
Especially
activity.
sports people would need that.
Yeah, I know.
If they're especially in their prime, or they would want to have a few more years
Yeah.
in that field, they couldn't
That's
afford. They can't afford
You
to
can't
not.
tell a footballer like, please don't play football after the ligament injury. So
Yeah.
we fix the ligament and we get them rehabilitation for a few months, and we let them play. And I encourage them. See, you did not do surgery to sit at home. You did surgery to get back to your original quality of life, isn't it? So that's the goal actually, and that's what we aim at also. We want to create a scenario wherein once the treatment is done, they should get back to their original level of activity 100%.
So it's not necessarily that surgery causes some amount of permanent damage.
See, there are some complicated fractures, like too many pieces, and there are scenarios when, of course, they would cause some permanent damage. But most of these sports injuries, I can say, it's pretty evolved over all these years. Most of our sports injuries, they get back to 100% activities. All these people with muscle tears in the shoulder or dislocations, as I told you, all these knee ligament injuries, all of them, they get back to 100% activities. We have quite a few of sports people like who are pursuing sport as a profession, who come to us and get fixed, and then they're getting back to
They're back to normal.
Yeah.
That's good news, especially for sports people and aspiring sports people. Thank you for joining me on this show, Dr. Lokesh Veerappa. He's a senior consultant, orthopedic surgeon and sports medicine specialist. This is Surgeon on Air on Fever 104 FM, brought to you by Sironix and arthroscopy division of Healthium MedTech. Thank you for joining me on the show, Doctor.
Thank you, Adarsh. It was nice interacting with you. Yeah.
Thank you so much.